Hey everybody. So a while back when all this, Corona knowledge became popular in America, the doctors, the government, representing doctors in particular who spoke in front of national television would tell people, oh, don't wear a mask, right? This is like the flu, right? Mask won't protect you, and so people really started to believe in that. And then they would probably even attack or chastise or harass people who wore masks, And then soon, slowly, people started getting really sick. And then soon, a lot of people started dying, And then I think now the numbers are near 3,000 deaths just in New York alone, right? And I think that number jumped by like some 600, near 600 overnight. From like this past weekend, right, of April, what's today, April 5th? Yeah, April 5th, right, to April 6th, right, 500 people, right, they reported them, just dead from the virus. And so most of these people, I can assure you, did not wear masks. And a lot of people still in the streets do not wear masks, right? The countries that you can see that they have the virus under situation, they had people quarantined, definitely wearing masks, shouting at people who would not even wear masks. Like literally, they would have a drone fly in a person's face who was not wearing a mask. And then the person, who's controlling the drone would say, oh, why are you not wearing your mask? They would be shouting at the person, right? The police officer, whoever is controlling the drone, right? And so I just want to really encourage you to wear a mask, all right? And then so now the whole thing is, and partially it's due to marketing, right? You wear an N95 mask like this, right? That says N95. Or you wear a surgical mask, right? And so, like countries that wear either, most of the situation is really underhand, and like, yes, the N95 is that much more protective, but look, doctors in hospitals are still wearing surgical masks and they have to deal with COVID-19 patients all the time, right? Now they're moving to N95 because they want to improve their quality of work ethics, right? But, I think most people should at least in the bare minimum, please wear a mask, because if you yourself would not be infected, you will affect someone else. You could be a catalyst. It's like tuberculosis, where you could be a carrier, right? And the virus may be in you, but, you may not have it completely activated or feel the full brunt of the symptoms that it could, do upon you, all right? So anyway, I just wanted to make a comparison between the both masks. The first one is the regular surgical mask, right? Notice, just put it on, right? Try not to put your hand inside the mask before you put it on, and then fix your nose, right? And then, so, you could just also pull, right? This metal piece right here is going to hold the mask from dropping lower or dipping lower. You can adjust it, right? And so that's how it would be. You see? Now, what happens here is on my ears, sometimes it gets irritable and a rash forms, right? And so, you probably want to, at that time, use like rubbing alcohol to wash your ears, right? Or just change to a new one because maybe there's something wrong with the latex, or the threads in here, right? Or just like use rubbing alcohol to wash the thread, right? And of course, it's not recommended from the sources that I have to use these for more than 4 hours at a time. All right, so that's what they're saying. Don't use these for more than 4 hours in, even a succession. So let's say in the span of 4 days, used an hour of each day, just toss it, right? So that's what, my peoples are telling me, all right? So this is the N95, right? It looks like the construction mask. As a matter of fact, I believe construction people have been using this. It's just that they don't really label it as much N95, and this is like a marketing strategy too, blocks at 95%, and probably it does, but, so this is how you put it on. So, again, I'm not touching it. Put both Okay? So you see, covering my whole face. Push it in, okay? And then over here, the strap, you could either do this and this, right? Okay? As you can see. Okay? And then over here, the headpiece, right? Some people like to put it this way. Some people like to just put it on the ear and hook it, right? So, look, I don't believe there's an absolute right or wrong. A lot of doctors, because they are told, by people to do it this certain way, and it's that absolute certain way. A lot of people buy into that. All right, a lot of people buy into that, to make themselves look good or sound good or sound like, take advantage of being an authority, because they're probably under pressure, they're being paid to. As long as you're not wearing a mask like this, or like this, or like this, or even like this, right? That's just, don't be ridiculous when you wear a mask, all right? As long as you cover your entire face, nose and mouth, have a lot of space above your nose and below your mouth, like underneath even your chin, that's all you really have to do, and make sure that it is secure, right? It will not fall out or drop off, all right? If you feel like, it keeps falling out or dropping off, secure it, secure it, tighten it, and that's how you really put it on. All right. Again, out of the billions of people who wear masks, they don't all follow an exact way of doing it, but they do it and it works. Who's one to say, oh, you're wrong or you're right, Unless you're just, being ridiculous with it. All right. So I just wanted to share that as a public service announcement, and be safe. Be healthy. Take care of yourself. Thank you.